Today we're going to talk about the evolution of fire and emergency services. The first fire protection service on record in North America started in 1648 in the town of New Amsterdam, which is now part of New York City. It was an all-volunteer organization. Not long after its establishment, the public began to demand fire safety codes and paid fire departments to combat fires in large cities across the country. Other towns and cities developed their own fire departments, and now there are more than 30,000 fire departments across the United States. Emergency medical response also started out on a small scale. The pre-hospital medical response system, the first pre-hospital medical response system on record, served Napoleon's army in 1797. Civilian ambulance services in the United States began transporting patients to hospitals in Cincinnati in 1865 and New York City in 1869. It wasn't until the early 1900s that the need for consistent national standards was realized. In the early 1900s, the National Board of Fire Underwriters created the ISO grading schedule for municipal fire protection. This document was created after insurance providers went bankrupt trying to pay claims from citywide fires. The insurance industry then began to advocate for the need for fire departments to prepare for large-scale fires. Municipalities that did not conform to the ISO's recommendations faced the threat of higher insurance premiums. Today, municipalities are graded on a scale of 1 to 10, with a Class 1 rating being the best and a Class 10 rating being the worst. In 1968, the Fire Research and Safety Act was created, establishing the National Commission on Fire Prevention and Control. This national effort to professionalize fire service began with the Commission's America Burning Report. This report influenced the development of several NFPA standards for training, safety, and professional qualifications for fire service members. Some of the recommendations included the establishment of a national fire data system, provide federal financial help for planning, training, equipment, research, and fire safety education, and annually inspect homes for fire safety. The development of the modern emergency medical services began with the publication of a paper in 1966 by the National Academy of Sciences National Research Council. The paper, Accidental Death and Disability, the Neglected Disease of Modern Society, called for a national effort to address injury, which was the leading cause of death of persons under the age of 37. The report showed that many ambulances and emergency medical treatment facilities were inappropriately designed, ill-equipped, and staffed by inadequately trained personnel. When the Highway Safety Act of 1966 was adopted, it established the Emergency Medical Services Program in the Department of Transportation. The Department of Transportation had the authority to improve EMS through implementation and the development of standards. States were required to develop regional EMS systems. Military medics returned from the Vietnam War with experience in professional emergency training, organization, and equipment also created change in modern emergency services. These medics brought with them an expertise that had not been seen in previous emergency medical service systems. The role of fire service has expanded to include medical response, fire prevention, and public education. There are currently 4 levels of EMS providers: emergency medical responder, emergency medical technician, advanced emergency medical technician, and paramedic. Approximately 60% of fire departments provide some emergency medical services. The departments that do not are mostly all volunteer departments that serve small communities. During the 1960s and 70s, major disasters such as hurricanes and earthquakes brought the need for national emergency response efforts to the forefront. In 1979, the Federal Emergency Management Agency, FEMA, was established to consolidate federal disaster response, which at the time included the USFA and the Civil Preparedness Agency in the Department of Defense. The Forest Service developed the National Interagency Incident Management System in the early 1970s to ensure that fire protection agencies were prepared and organized to be able to fight destructive wildfires in the West. In 2002, the federal government established the U.S. Department of Homeland Security, and in 2003, FEMA became a part of the Department of Homeland Security and continues to manage the nation's response to major disasters.